Which allergy medicines are safer to take with liver cirrhosis? Second generation antihistamines like fexofenadine and cetirizine, along with intranasal corticosteroids and topical sodium chromoglycate, are generally considered lower risk options, but always speak with your GP, hepatologist, or pharmacist before starting anything new. Have you ever wondered whether your usual allergy medicine is safe to take if you have liver cirrhosis? It's a really important question, and the answer isn't straightforward. The liver plays a central role in processing most medications, so when cirrhosis is present, even common over the counter allergy treatments can behave very differently in your body. Cirrhosis is a condition where healthy liver tissue is gradually replaced by scar tissue, which affects the liver's ability to break down and clear drugs from the bloodstream. The result? Medications can accumulate to higher levels than intended and stay in your system for longer, raising the risk of side effects and, in some cases, serious complications. A few things drive this. Cirrhosis reduces the activity of enzymes, particularly cytochrome P450 enzymes, responsible for metabolizing many medicines. It also causes portosystemic shunting, where blood bypasses the liver through alternative vessels, meaning drugs don't get processed properly. Lower albumin levels can also affect how drugs are distributed and cleared. So what does this mean for allergy medicines specifically? The most important thing to know is that first-generation antihistamines, things like chlorpheniramine or promethazine, are generally avoided in cirrhosis. These are heavily processed by the liver, and they can trigger or worsen hepatic encephalopathy, a serious condition where toxins build up in the blood and affect brain function. This is a significant risk, and it's why these older antihistamines are generally not appropriate for people with cirrhosis. Second-generation antihistamines are generally a safer option. Fexofenadine, in particular, is minimally metabolized by the liver, making it less likely to accumulate. Cetirizine may also be considered, though because it's partly cleared by the kidneys, your renal function would need to be taken into account. Your doctor or pharmacist can advise on what's most appropriate for your situation. For nasal allergy symptoms, intranasal corticosteroids, such as fluticasone or mometasone nasal sprays, are generally preferred. Because they're applied directly to the nasal passages, very little is absorbed into the bloodstream, making them a much lower risk option. Topical sodium chromoglycate used for eye or nasal symptoms is also applied locally with minimal systemic absorption, which is why it's generally considered lower risk as well, though it works through a different mechanism to corticosteroids. Now, what should you avoid? Oral decongestants, like pseudoephedrine or phenylephrine, are generally avoided in cirrhosis due to cardiovascular and renal risks. Anti-inflammatory painkillers, known as NSAIDs, are also contraindicated. NICE guidance specifically advises against NSAIDs in patients with ascites, a complication of cirrhosis involving fluid buildup in the abdomen due to the risk of kidney damage and gastrointestinal bleeding. And here's something that surprises a lot of people. Over-the-counter doesn't mean safe for everyone. Many combination cold and allergy products contain decongestants or anti-inflammatories. If you have cirrhosis, always check with your GP, hepatologist, or pharmacist before picking anything up from a pharmacy shelf. And do not start, stop, or adjust any medicine without their guidance. If you experience a suspected reaction to any medication, you can report it through the MHRA Yellow Card scheme. Your pharmacist can help you with that. To recap, cirrhosis significantly changes how allergy medicines are processed. First-generation antihistamines are generally avoided due to the risk of hepatic encephalopathy. Second-generation options like fexofenadine and topical treatments like intranasal corticosteroids are generally considered safer, but always under medical guidance tailored to your individual circumstances. If you notice any new or worsening symptoms after starting an allergy medicine, particularly confusion, unusual drowsiness, or changes in behavior, contact your doctor promptly. If you found this helpful, leave a comment below, especially if there's a topic you'd like us to cover next. Give this video a like and subscribe to Bolt Pharmacy for more evidence-based health information. We'll see you in the next one.